Hello everyone, I've done my project following a CT cervical myelogram exam. So for starters, I just wanted to give a brief explanation on what exactly a CT cervical myelogram is and what it entails. So a patient undergoing a CT cervical myelogram, first off, they start off in the x-ray department where they will undergo the fluoroscopy part of the exam. They will work with the radiologist, and where the radiologist will use live x-ray to help aid in the process of introducing contrast media into the spinal canal. The contrast used must be for intrathecal use, since we are injecting into the subarachnoid space. At my facility, we use IsoView 200. So the patient will be prone, lying on the stomach, with the radiologist using the fluoro to confirm placement of the spinal needle. When I've personally seen these done, the radiologist goes in at the lumbar region, and he will then tilt the table to where the contrast will flow down into the cervical region. So once this is achieved, the radiologist may get more overheads. They may or may not, it just depends. From this point, the patient would then be sent to the CT department, where they will undergo the scan. At my workplace, our protocol consists of axial imaging in standard and bone window with sagittal and coronal reformats. Okay, so while I have been able to follow this exam in the past, at least in the x-ray portion, I was unable to do this again for this assignment. So what I did was found a case study online to read and follow and kind of use as my patient. Anyways, I found a case study. It involved a 77-year-old woman. She had a history of a brain aneurysm, so she had metal clips, and then she was also affected by a disease called von Willebrand factor. So VWF is a protein that binds to clotting factor 8, where it aids in circulation, and it also helps platelets bind with injured blood vessels to help stop bleeding. So with this disease, if a patient has this, they have a deficiency in the von Willebrand factor, which leads to them having troubles forming clots, blood clots, making it hard to stop bleeding when injured. So the patient presented to the ED with symptoms of sudden onset of severe neck pain without any known cause or trauma. Within a few hours of her being admitted into the hospital, the patient's pain in the neck began to subside, although she then began to experience weakness and numbness with a tingly pins and needles sensation to both arms and legs. So the doctor ordered a CT cervical myelogram. I'm not completely positive. It doesn't explain why or how he decided to order this exam. There wasn't any information regarding whether the patient had any other scans during her visit that would warrant the doctor to want to order this exam. I'm sure the patient's medical history with the von Willebrand disease having to play in his decision. And I know that ordering an MRI was out of the question since she did have the clips from a previous aneurysm. This is a picture from her exam. This is done in the X-ray portion with the contrast. So this picture shows T1 contrast filling defect with suspicion for spinal cord compression. So after the patient had the intrathecal contrast injected back in X-ray, the patient underwent the CT portion of the exam where they found evidence of a filling defect between levels C5 through T1 as shown in this image, and then with the spinal cord being compressed. This could have been why the patient was experiencing spontaneous neck pain along with weakness in the extremities. She was eventually diagnosed with a spontaneous epidural hematoma. This is when there is an accumulation of blood within the epidural space. Okay, so here are more images. The one on the right is showing filling defects at level C6, as well as the bottom one on the left shows filling defects at level C7. Treatment of the hematoma involved administering desmopressin, frozen platelets, and anti-hemophilic factor / von Willebrand factor complex. These are all treatments to help aid in blood flow and blood clotting, which she was lacking due to her disease. She also underwent surgery for a decompression laminectomy, which was done to help create space within the spinal canal, which would allow for free movement of the cord and spinal nerves. They also removed the hematoma. And then this is another image from her scan here. Okay, so for follow-up, while the patient was still undergoing this diagnosis, there was no record of any follow-up or delayed scans completed. However, the patient did have a 1 month post-op visit in which she reported having a good recovery with normal strength and sensation were returned back to her arms and legs. Okay, so a few questions that I didn't get to touch base on were whether there were any previous scans done that wasn't covered, so it's unlikely. They didn't report any allergies to any contrast. This would be good since she had the intrathecal contrast injected. So no pre-medications were noted either. And then it's unknown if they adjusted any parameters for shielding to save the patient dose, although I don't really know like how likely that would be to be done on a patient in around her age. So, what did I learn? Well, it was unfortunate that I wasn't able to follow a patient through this exam in real life. I was able to follow one or a couple in the past, just through the x-ray portion. So I knew that at least. And then I was able to follow up with our CT staff and find out what our protocols are and get a better understanding of what was done on their end of things. So that was nice. In addition to that, I also got to learn about this interesting disease process of Van Willebrand disease. So that was good, and an added bonus for the assignment. Here are some references.